We look at them every day in the mirror, sometimes wondering what we can do to make them look younger. Our next guest, Dr. Jeffrey Kwitko, is here to give you an answer for maybe what you're looking for. Today, we're talking about eyelids, correct, doctor?
Absolutely.
Popular surgery? I had never really heard about it before. Is this something that is increasing in popularity as people are starting to complain about it a little more?
Very popular. A lot of women have been doing it for a long time, and now more men are having it done to help them not only look better, but to see better as well.
Interesting. So it's definitely a twofold process.
Absolutely.
You know, it seems like that is somewhere you do kind of see age, though, now that I'm thinking about it, especially with women trying to put on eyeshadow and thing. I'm sure that cleans it all up.
It's one of the most common comments I get after surgery is women now are able to put their makeup on because they can see their eyelids again without it getting everywhere. And that's what women seem to appreciate more than anything, is now they can put their makeup on again.
Well, let's back up. Let's say someone's interested in getting this surgery. They're looking in the mirror, they're not happy with what they're seeing. What are the best ways to go find a doctor like yourself that can perform this and perform this well?
There are specialty doctors who do this. Myself, I'm an ophthalmologist who did subspecialty training in cosmetic eyelid surgery. So not only am I trained as a medical doctor in ophthalmology, but also in plastic surgery of the eyelids. And that's an extra year or two of training after you do your ophthalmology training. And I think probably that's the most important type of doctor that you should go to if you're considering having your eyelids done. We have to remember that the eyelids are there to protect the eyes, and that has to be kept in mind. And an ophthalmologist will always have that in the back of his mind when he's performing cosmetic eyelid surgery on you, that we have to make sure that the eyes are protected, and then we can go and get a better functional and cosmetic result.
How would someone that was interested in this go about doing their research or trying to find the doctor that's right for them?
Well, you can do research. It's very easy on the internet to find board-certified ophthalmologists. And then what you want to look for is a board-certified ophthalmologist who did fellowship training in oculoplastic surgery. Okay. And that's easy to find on the internet at the American Board of Medical Specialties.
What about having a good candidate? What if someone's like, well, I don't know if I'd be good, maybe this is going on. Who would be a good candidate for this surgery that you could recommend?
You want people in good health. Okay. You want people who don't suffer from dry eyes, because having your eyelids done can make dry eyes worse, which is one of the reasons you want to go to an ophthalmologist, because they can evaluate that better beforehand and warn the patient if there's a possibility that this could happen. There are some things we can do before cosmetic eyelid surgery to alleviate dry eyes and decrease the risk of increasing that, and then go ahead and do the cosmetic eyelid surgery. So we want healthy people with no other eye disease who don't suffer from severe dryness in their eyes.
And Dr. Kwitko, lucky for us, you actually brought some before and afters that we do want to take a look at to really show what you can do. Take a look there and talk about the differences of what you were able to accomplish.
Well, the key with cosmetic eyelid surgery is you want it to look improved, but you don't want it to look fake. You don't want people to look and say, oh, you had plastic surgery, you had work done. You want to look refreshed, more alert, younger, but you don't want to have that artificial look where people say, oh, you had plastic surgery done. And we all know that there's a lot of stars and celebrities out there we look at and we go, oh my God, what did they do to themselves? So if you look at this picture, we see that we can see the eyelids again, but they don't look too hollow, and they certainly don't have that scared clown look. And I hear this all the time when people coming in for consults, is they don't want the scared clown look where the brows are lifted too much. And that's people's #1 concern, that they don't want to look artificial. So you want a natural, refreshed appearance. It's not something that people would say, oh, you had plastic surgery. You don't want that to be #1 when people look at you.
And I'm sure, given your experience and your expertise, you're the guy to call.
You learn a few things having done this for many years, and I've been doing this for about 25 years now.
Well, thank you so much for your time. And for more information, if you're interested and want to call Dr. Kwitko, call him at 813-877-8665 or just log on to kwitko.com.